for the delay. It takes a little time to get all of our technology in line here in this 21st century. But we appreciate you tuning in. This is Monday, April 6th, and this is our Westchester County update on the outbreak of coronavirus. There's quite a bit to talk about, but I want to mention, first of all, that I have with me a mask, which I use normally when I am outside of a communication setting like this. The CDC has advised us all to wear masks when we're out in public, and I'm doing that, and I don't think it's any insult to my dignity as a public official. I think it's a sign of common sense, and we encourage you to do the same thing to the extent possible. We have lowered our county government and county property American flags to half-mast. We have lost, by our current count, 211 Westchester residents to the coronavirus outbreak. We cannot order all flags to be lowered to half-mast. That privilege belongs to the governor and the president, but we certainly control those that are on the county office building and other county facilities, and we're doing that out of respect to those we've lost. We each know now individuals in some part of our circle that have lost a loved one, and the emotion and the difficulty in losing somebody we love is always difficult, and then exacerbated by the fact that it is due to this virus. So we will have a little bit later in the week a small ceremony. We have to make sure that we keep it within the bounds that we've described, which is small gatherings, properly socially distanced, but we will have a small ceremony to recognize and remember those that have passed away, and we expect that we may yet have to do that more than once to properly recognize all those who have died. This is a serious issue, and now that we have a face to the virus, the face of people that we know and love, it becomes much more important that we do the correct thing. A couple of brief items before we talk about some numbers and some other policies we're working on. Westchester County Center right now is in the process of being transformed into a temporary hospital. We believe it's going to open sometime between now and a week from Friday, maybe sooner rather than later. It will be under the control of the State Health Department, working through White Plains Hospital. We expect it will have 120 beds that will be used for patients in need of health care. It will be the decision of the State Department of Health as to whether or not that particular facility will be used for COVID patients or non-COVID patients. We as a county are happy to turn the county center over for that usage, because we think that's critical in order to get the bed count up to a number that can handle what might be the surge or the peak of number of patients here in Westchester County. And of course, there's no walls around Westchester County, so if what we're doing is providing a bed for all who need it, and that bed also involves somebody from outside of Westchester County, from Rockland County or Orange County, Dutchess or Putnam County or New York City, then we want to try to use every item at our disposal to save a human life. And we're not worried too much about the geography. But we want to make sure as best as we can that we're dealing with our New York and our Westchester County neighbors and friends. That is what's happening at the county center. If you pass by it now, you'll see tents outside. You won't be able to go inside, but there's a transformation of that facility where we're accustomed to seeing sports and exhibits turned into what we hope will be a life-saving location. The numbers that were announced for the number of cases today from New York State, Governor had a press conference a little earlier today. He indicated that there's a total of 14,294 Westchester residents that have now tested positive for COVID-19. There are a number of those individuals that have aggregated over time that have now gone 2 weeks without having symptoms of the virus, and it is presumed that they are now healthy enough to be able to resume somewhat normal behaviors. So there is a subtraction off of that absolute number, and that number is going to start to get larger as we look back and say 2 weeks ago, we had over 1,000 patients, perhaps a bit more than that, and that's important. Westchester County is now behind Nassau County in the number of positive cases, and behind New York City. Suffolk County is very close to the numbers we have. This is not tracking the NBA standings. What this is to try to understand, has Westchester started to reach a point at which we can see the flattening of the curve? We're certainly not there yet, but is it within sight? And when we notice that over the last 2 days, that both Suffolk and Nassau County, which have higher populations than we do, have had more positive cases than us, that may be that sign coming. It's also important because we've still tested more people in Westchester County than Nassau or Suffolk. When this contagion originally began 4 weeks ago, Westchester County had a quick burst of numbers of cases. We were ahead of everybody. We were ahead of New York City, and people thought that there was something intrinsically geographic about the nature of the virus. Now what we find out is that when we test over a wide area, generally population figures will indicate which jurisdictions have more virus than the others. And then how many new cases you add, given that initial base, is really the indication of how much more the virus is spreading. So we hope that what we're seeing is the beginning of a trend. It is too soon to tell. It'll be too soon tomorrow. It'll be too soon on Wednesday. But we're going to track the numbers to try to make a discussion that is intelligent and then work our plans around that reality. 14,294 positive cases. We have 211 Westchester individuals that have died as of the last number that we have, which is more than 24 hours ago. We may get a revised number before the end of the day. And we know that there are many people right now that are hospitalized. We have a grand total 345 individuals in Westchester County that are hospitalized. As a percentage of the total positive cases, that's a very low percentage. We've worked on the basis that it would be about a 20% ratio of the number of people hospitalized versus the number of positive cases. And 345 is a significantly smaller number than we might have thought, somewhere in the vicinity of 3.5 to less than 4%. That number during the peak will rise. We will have more people hospitalized as a percentage of the total number of positive cases. And that is where the jeopardy is. When you have more people hospitalized and insufficient number of beds, insufficient amount of personal protective equipment, PPEs, insufficient number of doctors, and insufficient number of ventilators, then we have things to be concerned about. We are expecting a shipment today from New York State of additional PPEs and also ventilators that can be used to complement the existing staff of those facilities that are here in Westchester County already. We have 3,000 beds in Westchester County through our existing hospital system, adding additional beds in each of those hospitals, adding the county center to that, we hope will give us an appropriate number of beds to handle the demand that comes up. In terms of the local breakdown, we caution that the numbers that we've received include a large number of unknown cases that for which the individuals tested positive, but the health department cannot identify their geography for whatever reason. These are the results that are coming back from the labs when the tests are done. So the numbers we're given today could be as much as 1/3 of the actual numbers. We don't know, but we want to share with you the numbers that we do have. It does give you a relative idea of where the different communities stack up. And as I've said, every time I've read these numbers, they basically track the general population of Westchester communities. Our current greatest number of cases is in the city of Yonkers, 1,393 cases in Yonkers, as have been reported to this point. That could be a couple of day lag. New Rochelle is at 659. Mount Vernon is at 583. The town of Greenburgh is at 568, and that includes the unincorporated portion of Greenburgh at 291, and the 6 villages totaling 277 cases, so they're at 568. White Plains has 377 cases. The village of Osling has 283 cases. The village of Portchester has 254 cases. Cortland has an aggregate of 231 cases, 188 in unincorporated Cortland, and 43 in the 2 villages that comprise Cortland. Yorktown has 182 cases, and Peekskill at 157 cases. Those numbers tell us that, again, the general population flow makes those determinations. We have communities in the southern part of Westchester. We have communities located across the central ridge of Westchester, from Portchester to White Plains. We have northern Westchester communities in Cortland, Yorktown, and Peekskill. So this is not geographically based on a portion of Westchester. This contagion is across the county. But we are encouraged that our testing to this point has made a very positive result of being able to track it. And I think probably the great concern that we have now is the number of places in the United States of America that have not been tested. And they are working on the belief that they have 100 or 200 cases, but in fact, they too have thousands of cases. And hopefully they're making contingent plans, as we have made, to try to accommodate that surge when it comes. It might come after our surge, but whenever it comes, and we'll certainly be there to help people anywhere in this country. But at least we believe in Westchester, through the work of New York State, we're trying to be ready for that. That is our responsibility, to try to save lives, to try to be ready for this contagion. County Health Department has received almost $1 million from the New York State to reimburse our activities in COVID-19. The money is targeted through the County Health Department. It involves a number of different things that will help us deal with the shifting responsibilities for COVID. We have put public health nurses out there to do testing. We have nurses that are doing some of the investigative work to find out the other people that individuals come in contact with. And when this contagion began, we were dealing in numbers that were two-digit numbers, 50 people, 75 people. Now we're dealing with digits of five numbers, thousands of people in the teens. And this is a very difficult task, and we really salute our first-line employees, nurses, and doctors for the work that they're doing. The money that we get from New York State is essential in order for us to do this work. Taxpayers of Westchester County cannot afford to do this on their own. The fact that this is part of a statewide response to the contagion is important. And I think these are the moments where you have to not consider what it is that a specific level of government is doing or not doing. It's that all of us have to work together, that all of us have to find that area of responsibility that we have, execute our role well, do that in harmony with the towns, the villages, the cities, with the state government, and ultimately with the federal government as well. I have a very somber bit of information to share with you. Westchester County has received a trailer that will be used for morgue purposes. We now have, day after day, more people dying at any singular point in time than we would normally expect to have. And it is an emotionally awful experience to have a loved one die. Almost all of us of a certain age have had that experience with our parents and other loved ones. To have as many die in such a short period of time, there is a practical reality of how we handle the funeral and the burial of that individual. Our rules right now do not allow for large funerals. It does not allow for large burial site services, all of which properly honor the dead, properly give us a chance to grieve when we've lost somebody that means something to us. But in order to protect those who still live, those types of gatherings are bad. So we are having to deal now with a backlog of those who have died and how to handle that process. This temporary morgue trailer was done through a New York State vendor. We have it outside of our labs and researches operation in Valhalla, and it will help assist the hospitals who also have this challenge of dealing with those who have passed away and still having to deal with the physical remains as it's afterwards. It is not a pleasant topic to discuss. What it does do is it makes this real, just as much as when you know somebody, a family friend or a relative who's passed away. It's even worse now to consider that we have a fatality management problem. But these are the things that happen in government. Somebody has to do this connective work, and this falls to our responsibility. There's a proof of isolation release letter that has been prepared and made possible. You will find it on our various website, westchestergov.com website. It is entitled COVID Release Request. And if you do that, .westchestergov.com, you will see a copy of what that application looks like. It is something that an individual would fill out. It asks if you've tested positive for COVID-19, the contact information if you have any symptoms. As we've talked about before, it's probably too much to go into now. There are certain categories that will determine whether you're able to resume your normal life now that you've had COVID-19, tested positive, but you've gone a certain number of days, 14 days, without contracting the disease in full, where you've been symptom-free for 7 days. You've been fever-free for at least 3 days without applying any fever-reducing situation. And if you've been asymptomatic or symptomatic in the past, there's a process that you have to certify that the answers are true, correct to the best of your ability. You're signing a legal document subject to perjury. There's electronic delivery of the letter, which you have to consent to. And all of that is also true for quarantine release letters. This also may be important if you are quarantined or isolated, and that affects your work situation, where you may need to have that. We have mentioned a couple of times before that we have economic development loan programs that are out there. Our Department of Economic Development is working to try to make it easy and available for different organizations to apply for that, different small businesses. And right now, our economic development team, led by Bridget Gibbons, is looking for volunteers to come and help do the intake and the training. Once we open this up, Small Business Administration Economic Injury Disaster Loan Advance, and then also the loan itself, the Paycheck Protection Program programs. These are complicated programs that need to have information filled out. A business person who sees or knows that they want some help can contact our office, Economic Development at westchestergov.com, and we're looking for volunteers who will come on, be trained, and then be able to help with the intake, because we expect to have a flood of businesses that are going to be in this situation. We know that the economy has taken a terrible hit from all of this, and we don't want to just sit around and wring our hands. We want to do something productive and something reasonable and something that will help them get back on their feet. The money's being provided through the federal government. Our job is to help you apply for it so that you can qualify. And if you have any questions, 995-2900, ask for Bridget Gibbons, and the message will get through to her, and she can follow up and give you more details. But this training and this program has been conducted in coordination with Small Business Administration and also Community Capital. And we thank them both for their work on that, and hopefully we can be good partners in implementing that. We continue to monitor all of our parks. We have not closed our parks. That is a source of some controversy out there, that some people that believe strongly that all the parks should be closed. I have followed advice from health professionals who say that parks do not intrinsically have to be closed, as long as the activity there is done with social spacing, proper spacing, and that it represents, if there are going to be any sports there, that the kind of sports that allow for that. Hiking, biking, we've had a big debate over golf. I'm not going to revisit that. I've made the case. If you don't agree with me, then you have a right. This is a democracy to disagree. On the other hand, I defend the point of view that I take, which is that golf as a particular sport is not a contact sport, and you can socially space. And I've personally gone out over the course of this week and the prior weekend. Westchester County has 55 parks across the county. Some of them are seasonal. We have pools in Sprain Ridge and in Saxon Woods. We have a Playland pool and Wilson Woods pool. The pools are closed. The beaches are closed. Playland amusement parks, amusement rides, all of that is closed. Those are areas where people would congregate in great number, and it would be foolhardy to open them. They wouldn't normally be open this time of the year anyway. And we're going to have to make a decision very soon as to whether or not we delay openings of these facilities. And perhaps if we haven't reached the apex of the contagion, or something more severe happens, we may not open them at all, which would be a terrible blow to all of us. But we will make prudent decisions. On the other hand, the passive parks that we have, the hiking trails, the Bronx River Parkway Reservation, the North and South County Trailways, Cranberry Lake and Reed Sanctuary, Marshlands, and Lenoir Preserve. There's a host of nature centers. All of those have been open. We have hiking trails at Saxon Woods, separate entrance from the pool entrance. We have hiking trails at Nature Study Woods and at Twin Lakes Park. And I've made a point to go out and see most of these. I went to Mahanset Golf Course, to Maple Moor, and to Saxon Woods Golf Course to see for myself. I was at Kensico Dam in the late morning on Saturday. I spent an hour at Playland at the boardwalk and the beach on Sunday watching what was happening. I don't want people who make comment in general off of what they think is happening. Now, from time to time over the course of the day, there are concentrations of people. And the Parks Department and the County Police Department have done a very good job of trying to break up those concentrations, to be able to go over with bullhorn or otherwise advise people you must show social distancing. And I have found people to be very responsive to that message when advised of it. But the alternative is, if you have 85% of the people that are following the rules, 15% don't follow the rules, enforce the rules on the 15%. There are people out there who just say, shut it all down. I don't want to hear about it. That's fine. They may not live in an apartment building. They may not realize that people who are not required to be quarantined or isolated, when they walk out of their apartment building, are in a more densely populated urban environment and are more likely to spread the disease if they don't have a park to walk to or to go to, or a nature center to go to. So we are acting within advice that we've received. We know that medical advice differs. Dr. A believes one thing, doctor believes something different. Depends on whether their background is in public health and contagious diseases specifically, or they have general knowledge of it. We are trying very hard, excuse me, to make the right decisions as we can. Don't be concerned about my cough. I've checked it out already. It's not COVID. If it is, then I'll go into isolation like everybody else. I'm still wearing my mask if you see me on the street. But the minute I cough on TV, I get 15 text messages, are you okay, and so forth. We want to make sure we take this opportunity to give a big thank you to our first responders. Our EMS people, our fire departments, our police, and our nurses and doctors are the people on the front lines. They have put themselves before the contagion to save people and to help people. When the EMS comes to pick somebody up who may be suffering a heart attack, they may or may not know whether that person or anybody in the household is suffering from COVID-19. And, they still go in to try to save the individual. The fire department the same way when responding to a fire call, and the police the same way. We had 3 police officers a few weeks ago administering Narcan to an individual who had overdosed on drugs at one of our county parks. And that person had indicated that they were exposed to COVID-19. And the police officers are there trying to save that person's life. as part of that process. It turned out not to be the case. The officers tested negative, but those kind of fears are there every day. And certainly the nurses who have committed their career to helping people with health issues, but did not sign on to picking up a potentially fatal virus and bringing it home to their families, that they need the proper protection and the proper protocol of how to operate. As well, our doctors. If we lose our nurses and our doctors, no matter how many beds we have, we can't save lives. So we owe a great debt of gratitude to the nurses and the doctors and the other medical professionals who were involved, to the police, the fire, the EMS folks. And I would say do everything you can to thank them. On your own home social page, Facebook, Instagram, Twitter, whatever you choose, take a picture of yourself. If your kids are home, have them do a little drawing, thank you, put it out on social media, show people that you appreciate that public service does have its necessary timeframes. Many times people treat those of us in public office and public governmental roles as if somehow we're not working hard, we don't really care, we're just getting all these benefits and we're not contributing to this society. I worked for 20 years in corporate life. I worked for some major corporations, and I know what the private sector can be like and what the public sector can be like. They can be very different in many different ways. And in the private sector, you can work very hard, not just because you fear being fired, which in theory you could be, very little job protection, but you also work hard because you can be compensated additionally for the work you do. That doesn't happen in the public sector. So there's a balancing between both. But when you see a public health nurse out there with the masks on, going out to take blood from somebody who has gone through COVID-19 and is now donating blood so the plasma can be extracted to perhaps save another life, you have to be appreciative of that. I am appreciative of that. I hope you are too. And I hope you'll take it to do some sort of sign of that appreciation in your social life and in any other behaviors. All of our boards and commissions for Westchester County during the month of April are having meetings via the internet, whether it's by WebEx or Zoom or any of these other tools. There are now tools by which these advisory boards can meet and have productive meetings and at the same time not be in the same room. Tonight, I'm going to sit here in this office across the room at my desk, and I'm going to be calling into 5 separate municipal meetings. The meetings, if I can make all of them, of the White Plains Common Council, the Cortland Town Board, the Tarrytown Village Board, the Ardsley Village Board, and the Irvington Village Board. And all 5 of those, I'll be giving them an update, as we're doing now, on the progress of our efforts on COVID-19, and then taking their questions for any town council members, city council members, village trustees, mayors, and supervisors. These 5 will add to the 27 communities that I've already done this with, in almost every case, over the telephone or on Zoom or in some fashion, to show the cooperation between the county government and local governments. And I would argue, perhaps self-servingly, that this is the greatest effort that has ever been made by the county government to deal with the needs of the local governments on these situations. There's a variety of issues at hand, but we have reached out, I think, like has not been done in the past. And I think that is really what this job should be. And that's why we're trying to perform it that way. And so therefore, we have our boards and commissions meeting electronically. Local towns, villages, and cities are having their meetings electronically, and you, the citizens, can participate, can watch, can participate at appropriate times of all of that. I'm going to close before we do questions, just to send a message out. I'll probably do this each of the days of this week. We will not be broadcasting on Friday. We do know that Wednesday is the first night of Passover for all of our Jewish brothers and sisters as they enjoy the Seder. It's being done under very difficult circumstances. It may be near impossible, if not impossible, to have all the family members around the Seder table to participate in what is very much a family remembrance, a religious important tradition of what Passover represented. And then also for those of us who are Christian, as am I, this is Holy Week. We have Holy Thursday or Maundy Thursday, depending on how you describe it, Good Friday, and then Easter Sunday to follow, which is the most joyous day on the Christian calendar. It is going to be impossible for us to meet as a group the way that we would, as we missed Palm Sunday yesterday. And these are important symbolisms in our life. They give our life a certain substance when we are of faith. And our brothers and sisters who worship in other faith traditions, those who are Muslim, those who are Hindu, those who are Buddhist, those who may be Baha'i faith, whatever faith or no this tradition at all, we will still celebrate those days with you, even as your Christian and Jewish brothers and sisters this week will celebrate these important religious holidays. We are a secular government, and our job is to do the things that we have to do. We have to police the parkways. We have to fight the contagion. We have to treat sewerage. We have to run a county jail. We're not here to set social policy for the whole nation. That belongs, at other press conferences at other times of the day by other officials. But we're not automatons of politics. We're human beings. When we see people that we know pass away, we have the same human emotions. When we see that we're tasked with doing something for which there is no roadmap, there is no chart on the ocean to know how to navigate the ship, we do it based on what we think is the best way possible. When I talk with Joan McDonald, our Director of Operations, Ken Jenkins, our Deputy County Executive, or Catherine Chaffee, our Communications Director, John Nona, and we hear that we have a refrigerator truck that we are going to receive to store the bodies of those that have died. That is a sobering thought. That is nothing that I have ever experienced in my prior life in either public office or in the private sector. But we respond, we deal with these issues because that's what we're tasked to do. That's what it is to be in this job and to try to do a good job while I have it. Someone else will have this job in due time, but while I have it during this crisis, we're going to try to make the best possible decisions we can. We're going to try to learn from what's around us, and we're also going to try to remember that we're all in this together. When I wear this mask, I'm no different than anybody else. I'm the subject to this disease as you are. I have the same concern for the people that I love that you have for the people you love. This is not about politics. This is not about an election. Those things will come in due time. What it's about right now is survival. Survival for each of us and all of us. And we hope that we're doing everything we can to make that more possible for you and for your loved ones. So we'll take some questions. Catherine Chaffee has them off mic, and I'll try to answer them. And then if anybody in the press does not have an additional question, we'll certainly be happy to talk to them separately to answer their areas of interest. Catherine?
Okay, so the first question comes from Beth from News 12. She wants to know, are nursing homes allowed to keep their residents and families in the dark about coronavirus cases? That's her first question.
Well, unfortunately, nursing homes, or fortunately, whatever, nursing homes do not fall under the control of county governments. They exist within the county. I have many times been inside, the Osborne and Rye and Bayberry Care Center in New Rochelle, Kensington and White Plains, and Atria and Ardsley, but we don't have any direct regulatory authority. So the decisions made by the management of a particular nursing home is responsive to the state of New York. And if there are some concerns, then I would suggest, your state legislator is certainly happy to be an advocate for you. I had a position like that for a number of years. My colleagues who are still state legislators will be happy to advocate and try to get some answers for you. It's very difficult for me. There's quite a number of them who represent Westchester County, I think 11 or 12. But I would advise that since it is state authority, and rather than trying to call into the bureaucracy of the state health department, which is very difficult now, reach out to your local senator or assembly member. You can go online, since this is a state issue, to Assembly New York or Senate New York, and you'll find a website, and you can discern who is your representative to ask this question, because obviously it comes out of a very specific set of concerns over a specific nursing home.
Okay. Beth's second question is the county stepping in any capacity to assist nursing homes now showing clusters of cases?
Well, what we are interacting with nursing homes is we are a conduit for them to get PPEs, and under the direction of the state health department, if they assign us to deliver ventilators to a nursing home, we will do that. They will most likely tell us to deliver them to hospitals rather than nursing homes, but we're at the discretion of the state when it comes to these things. I have had from time to time a couple of the nursing home administrators whom I know call me, and then we've channeled their needs for additional supplies into the state pipeline. But again, we don't have that direct reporting responsibility in the county, so they're not reporting to us. They're not reporting the status of the people that are ill. They're not reporting any fatalities. So we're really not the direct line to do that. I'm not trying to dodge it. If it was our responsibility, we would certainly work on it, but it falls outside of our scope.
Those are all the questions we have.
Okay. Those are the questions we seem to have at the moment. And again, obviously, any of our friends in the press who have questions will reach out to us. The information about the breakdown by community of the number of positive cases will be disseminated to all members of the press, and that will appear online and in print and on video. So anyone in the public that's watching this will be able to see that information when it becomes available through our members of the press. I'm George Latimer. Appreciate very much you watching. We intend to be on tomorrow at 2 o'clock, and to maintain that for Wednesday and Thursday. We will not be here on Friday, Saturday, or Sunday. And obviously, we hope that this week, as sobering as it is in our day-to-day living, is a week of some comfort for you based on your theology and your faith tradition, and that together we will get through this. I have confidence we will. Americans rise to the occasion, and we're being tested, but we're going to pass the test. We're going to pass it together. Thanks very much for watching. Have a good day.